Welcome to week 3. This week we talk about animal disease. Wildlife disease is rarely a simple cause and effect situation. Usually it is the product of some profound change in the environment. So what are those changes? Disturbance of an animal's normal function, and diseases may assume enzootic or epizootic forms. For example, enzootic are chronic diseases. These may be systematic, not symptomatic, and diseases that occur on a routine basis in a population. Epizootic. These are eruptive diseases, and in this slide you see a bat with white nose syndrome, which we'll talk about this week. They are outbreaks that are not expected. They affect large numbers of individuals over a short time span. Some of the causes of disease are similar to humans: infection, a parasite, a physiological cause such as chemical imbalance, or cellular condition like cancer, nutritional, which is the poor quality or quantity of food, congenital, which is passed on to young at birth, or degenerative, caused by old age. There are also toxins in the environment. These can come from human actions such as pollution, industrial wastes, herbicides, pesticides, in other words, not naturally occurring, and may result in bioaccumulation or biomagnification. For example, many of us know about DDT, which caused eggshell thinning in higher level species such as predatory birds, bald eagles, peregrine falcons, those birds that are at the top of the food chain. The concentration of toxin occurs as it passes upwards through the trophic levels, and you can see a diagram of that on the right hand side. So why is it important to study disease in wildlife? First, they are reservoirs or a pool of animal populations that can serve as an infection source for other species. For example, coyotes and other wild canines are reservoirs for heartworm and rabies. Bison may be a possible reservoir of brucellosis. Now, this is not the same as a vector. A vector is an organism that transmit the disease within a population, such as a mosquito that transmit heartworm and malaria. Some diseases of wildlife may impact humans, such as rabies, brucellosis, and others. Why is it important to understand this? First of all, the density of animal populations. Most diseases are density dependent. So as the density of a population goes up, the chances of disease becoming more prevalent also go up. Wildlife disease can cause serious losses to endangered species populations. And here are some examples. In 1984, a virus killed 7 of the 39 whooping cranes, so 18% of them. Black-footed ferrets are impacted by canine distemper. Disease is part of the ecosystem, and generally it is part of the management puzzle, meaning it is there and it comes and goes. But some diseases actually can act as a natural population regulation mechanism. So it can balance populations, but it can also be devastating to populations, as in the outbreaks where large percentages of the population are wiped out. It's also important because of public perception. People are afraid that wildlife transmit disease and are concerned about that. And then the optics of how diseased animals are dealt with. Pretty much anytime you deal with or see diseased wildlife and the public see it, then you have an issue with the perception and how you deal with it. So it's very important to know what diseases are in the populations that you're responsible for and to have a plan as far as how to deal with such situations. Here's some examples of wildlife diseases. Brucellosis, typically in ungulates and bovines. We don't know about human brucellosis and whether that's transferred over, but this is a driving force behind pasteurization of milk products. The agent is Brucella bacteria. It's transmitted through bodily fluids, and the clinical signs in the field are aborted fetuses during later stages of gestation and weak premature young. Liver flukes are found in deer, but they're also found in sheep and cattle. Fasciola magna is the flatworm, and it requires a snail as an intermediate host. Tapeworms, definitely a host, a carnivore, and the immediate host is usually an herbivore. So back and forth between coyotes and rabbits, for example. There are several species of tapeworms, and again, they do definitely affect humans. Avian botulism has been in the news in recent years. Wildlife species such as waterfowl, shorebirds, and particularly gulls. It's Clostridium botulinum that produces the toxin, and it is found in the population. Again, it's only when it creates kind of an issue with a larger number of gulls, for example, that people become concerned. It becomes a paralysis situation, and the birds can't hold up their heads. I've seen this many times in gulls. Anaerobic conditions in the substrate, the subsoil, bacteria survive there for a great bit of time, so it's always around. And the prevention is to control water levels and remove carcasses of deceased individuals. Avian cholera is found especially in waterfowl, Pasteurella multicida, transmitted through direct inhalation or ingestion, and the signs and conditions are stress and cold conditions. The prevention is to remove and burn carcasses, flush and drain water, and limit the transmission. Rabies is one many are familiar with, and mammals are the reservoirs for this disease. Prevention is through vaccination, but that's not necessarily feasible in wildlife populations. In some states, they use sponge baits, which attract the animals that chew on them then, and they're inoculated in that way or vaccinated in that way. And vaccination for domestic pets at least keeps your domestic pets from being reservoirs as well. Rabies comes from a bite or a scratch of an infected animal, so it's a saliva contact typically. And you can see a map here that shows, the common animals that have rabies: raccoons, skunks, foxes, coyotes, across the United States. Just a news item that you can look at later if you pull up the PowerPoint. The first girl ever to survive rabies without being treated. Typically, once about 19 days has gone by after infection, a human interaction with a rabid animal, you cannot be treated after that 19th day. And it has been known up to this one woman that survived, young woman, it was 100% fatal. Chronic wasting disease, the wildlife species are cervids, which are basically deer. The agent is a prion. It's a group of diseases known as spongiform encephalopathies. It includes scrapies, bovine spongiform encephalopathy, also known as mad cow disease. Creutzfeldt-Jakob disease is what it's called in humans. And it affects the central nervous system, and brain lesions are what happens to the deer. Really don't understand a lot about it. We don't really understand about transmission very well. so that it's being studied, but it is found actually in more areas than is shown here. We're actually starting to see it in the east, in the general DC area, so it's getting close to the East Coast. Okay, it is a slow developing chronic disease. Animals waste away. Prions aren't persistent in the environment and aren't detectable. So they are trying to develop live animal tests. Right now, the only way you know something has chronic wasting disease is after it's deceased. You take a sample to a lab. So that makes it difficult to diagnose and to track. There are many difficulties in dealing with wildlife diseases. It's hard to sample wildlife. It's hard to detect diseased animals, and the carcasses are rarely found. There are very few diagnostic tests for wild animals. The knowledge of the diseases, the transmission, and the life cycles are not there. They're still not available. And people are very protective of wildlife. And so it becomes a difficult management issue to have sick or dying wildlife to manage. We need to conduct risk analysis of disease in wildlife because of the economic aspects, the human health aspects, how it affects livestock and other wildlife resources. You have to assess the risk, manage the risk, communicate information about the risks. And so there's a lot of state and federal activity in this area. And here are some references for you. So in summary, disease is an interaction in which an organism lives on or within a host or plant animal to the benefit of the disease agent and the detriment of the host. There are different types of transmission. Diseases are density dependent. The higher density the population, that greater the risk for disease. And the challenges for wildlife managers are numerous.